We can go ahead and get started. For those of you who don't know me, I'm Dr. Mugge, one of the senior neurosurgery residents at Inova Fairfax Hospital. So that's one of the caveats to this. So, talking about the anatomy and physiology of the crucifixion specifically, going to integrate a lot of the things, both from the biblical side of things to the physical side of things, things that we know practically, things that are written about. I was able to find more papers than I expected on this in the literature to kind of describe the whole process, what we know anatomically. There are a lot of conclusions that I came to with this. So, with that, there are some disclosures with this. So everything you see with this is strictly my own opinion, my own conclusions. These do not reflect the Department of Neurosurgery, Inova Fairfax, or any of the Inova corporations. I have to put this in here, it's force of habit. A couple other disclosures with this. One, I will pick on audience members. Two, there is audience participation with this. Number three is there's audience participation. I said I will explain crucifixion, I will not demonstrate. The fourth thing. So throughout the presentations, one way that I'm used to giving presentations in my field is if you have questions, ask questions while I'm going through this. Don't wait till the end and just let them stack all up, because there could be. So also try not to anticipate too much. Let me get through the stuff, and if there's another question to elaborate, just to keep things going. Which brings me to the last disclaimer with this. There are 43 slides with this. There's a lot of content with this. As I was putting this together, I kept coming across new passages and like, well, this really needs to be explained. I've gotten questions about this before. I've done these sorts of things before, so there's a lot of content here. If people want me to just speed through at any point, they're like, well, we're done, we've had it, that's fine. If not, I'm happy to just kind of keep going. I have nothing else to do. I'm happy to stay as long as people want me to afterwards in terms of getting through all of these different things, because I know that there's a lot to it. So why is this important? Why do I think that this is really kind of a meaningful thing? So we don't, as a body of Christ, as a populace, or really have a comprehension of what capital punishment is really like. A lot of us, even those of us who are athletes who work very hard, have an understanding of what the physical suffering is like, but we don't understand what this kind of suffering is like, particularly not this caliber. We don't have a real life representation of it. We don't see this. So we don't really know. So for too many people, this becomes a story, a component of the church year that doesn't really have anything to do with our lives. It doesn't really have anything to do with our faith. So because of that, we don't exactly know what the full sacrifice was, because we don't understand what an undertaking it actually was. So then, the last point is that this might be something I'm probably more adept to than a lot of other people in the room, is that most of the time when people encounter death in their daily lives, it's of their loved ones, it's in the setting of tragedy, not in the setting of sacrifice. And a lot of things need to be differentiated between what is tragedy in terms of, and then what is maliciousness. Tragedy by itself, in terms of how you understand this, is tragedy are the things that go accordance with the rules of order that God has laid down for us. So hurricanes, natural disasters, things that quote-unquote happen to good people that are in line with the laws that God has ordained and followed. That's tragedy. Things that will be covered in this talk are true maliciousness, evil done by people for the purpose and sole intent of hurting and causing suffering in other people. And those two things need to be differentiated. This is not tragedy. So with that, how's this kind of set up? So these are the 7 major things that I'm going to go to. Every single one of these kind of broken into 2 different sections. What exactly happened? Why did it happen that way? And what does it mean? So starting from Gethsemane all the way through the death of Christ, and then afterwards, a couple of conclusion slides, a couple of things bringing it all together. So, hematohydrinosis. A lot of long words. All right, so before I start, we have Latin aficionados here. Does anybody want to take a stab at what hemato means?
Oh, I shouldn't answer.
No, you got it. Yeah.
I know I did.
Okay, so you're on a roll now. Hydrinosis.
It's
Sweating. Okay. So put it together. Sweating blood. So this is biblical passages of when Christ is in Gethsemane. Every single time throughout all the Gospels, very, very consistency of sweat was like blood. So how in the world would you ever have sweating that profusely or a way that actually looks or like or resembles blood? So with that, what is the anatomy of the skin by itself? 7 different layers from the dermis through the epidermis through the deep connective tissue. Highly, highly vascularized. It's more vascularized in women than it is with men. The peripheral arterial supply in the periphery of women is much, much greater than men, which is why you all are cold all the time. But, which is also makes it even more, when you're under areas or times of extreme stress, catecholamines that are released, and I'll get into exactly what those are. Stress hormones, the adrenaline that goes, causes dilation of all of these vasculature blood vessels. Arterial more than venous. Venous carries the blood to your heart, arteries carry the blood away from the heart. The difference between these two, all of the red, which is arterial, is under high pressure. The vascular supply, or the venous supply by itself, is under low pressure. When you have a catecholamine surge, you'll have dilatation of all of this. When you have that close to the skin, you can actually hemorrhage into both the hair follicles and to the sweat glands. Now, you need an incredibly high amount of stress in order to do this, but this is a documented medical phenomenon. You have enough of a surge through this that causes increased blood flow to the entire skin that then causes active hemorrhage onto the skin surface via the pores. Now, what does that do in terms of its long run? Things to keep in mind as Christ starts in Gethsemane and goes all the way through. 1, he's already at an extremely stressed state of mind. 2, this breaks down skin, which is extremely important as we go from here to what he's about to go through. He's already starting at a depleted state. He's stressed, and he's starting to become something called hypovolemic. So his blood volume is less because he's actually losing fluid via sweat and blood right here. So it's a fairly straightforward concept. Dilatation of the arterioles causes rupture into the glands and pores itself. You can actually then sweat blood.
Quick question. You had mentioned that obviously extreme state of stress and it's been documented. Like, are we talking like concentration camps or like what level of stress are we talking?
Yeah, similar levels to that. The case reports that I was able to find is of patients who were hospitalized for other major catecholamine-related tumors, and which causes heightened amounts of stress, which then they were in the hospital at the time, which is the only reason it was documented. So this is another way of essentially describing all that. Emotional stress related increases your heart rate, increases your blood pressure. This dilatation of the vessels leads to leakage essentially over the skin surface. So it's been documented. It's one of the more simple mechanisms that I'll go through.
Is it something that like builds up and compounds on itself, and then you kind of reach like a state of exhaustion over it?
So it can, but the exhaustion that you feel after this is really twofold. One, whenever you have an adrenaline dump for any reason whatsoever, you always have a refractory rebuilding phase because essentially all of your adrenal glands have depleted. If you ever feel an intense state of stress and you feel all of a sudden shivers going through your whole body, that's literally the epinephrine dumping out of your, well, norepinephrine, not epinephrine, dumping out of your adrenals, which is causing that dilation, which is why you feel the cold and the shiver. After that, you do have a state of refractory period during which you have to replete that. So 1, that does cause a depression. 2, the actual volume level, once you become hypovolemic, the amount of blood in your body goes down, your whole circulatory system becomes compromised, which becomes very, very important in the very next section. So, leaves Gethsemane, he's arrested, he's tried, back and forth between Herod and Pontius Pilate. And they come down to the point where they decide, he releases Barabbas, hands him over to be crucified. Again, through all of the Gospels, very, very consistent language in terms of the decision was made, handed him over to be flogged, and to be crucified. So, very consistent story. What is not consistent, and this is where the areas of debate come in, what does this mean in terms of, okay, he was handed over to be flogged? Flogged. The exact same word is used in the entire Gospel. What does it actually mean? So, this is the original biblical way that scourging would occur. According to Jewish law, it would be a total of 39 lashes. So, this is the setup in terms of an actual post, arms were hanged above the head, and then these lashes were in this direction of this. 30 total times. So what is the goal of this and what actually happens with this? The entire purpose of this is to weaken the state as a whole, to deplete the victim of energy, of reserve, and actually to cause further bleeding. So how, in this by itself, how would it actually do that in terms of doing this? So one, surface area. Tim, what muscle is in this area?
That's his back, right?
Yeah.
Yeah, so your lats, rhomboids.
Yeah. How much surface area is that?
How much?
Yeah.
Well, I don't know the exact amount, but it's a lot. Big muscles.
It's a lot. Large surface area, large vascular supply. So, with the scourging, what would happen? Whips are designed with either small marbles or small hooks, such that when the victim is hit, there would actually be embedding of these small things, and I use things because it could be any number of things, within the skin that were then ripped out. And the reason for that is that they actually intentionally want to cause significant physical damage to the dermis, subdermis, muscle, everything. They want to literally shred the back of the victim's back, and they do this intentionally.
Would the Romans have done this then?
Yes.
This is, you said this is according to Jewish law.
According to Jewish law, this is the minimum they should have is 39. But the Romans would have actually done this because they were at the time in that area, they would have been the only one that were legally had the authority to do this. So, what exactly does this do? And how painful is this really? So, receptors in your skin, starting at the top level and going all the way down. We always remember this for boards. You look at the ones that start with M, Merkel's disc, Meissner corpuscles, they're at the top. Pisidian ones and Raffinian ones lower down. So sense vibration, positional changes, and then free nerve endings. Highly, highly sensitive to pain. And the distribution of these vary throughout your body tremendously. And the dermatomes, which is also something that's highly, highly specific. So you look over the whole back area by itself. This might be the only way that in which Christ did not suffer or suffered less with this. You think about the tips of your fingers, the relative spacing in between all of these receptors is very, very minute. And if you look at the actual sensory cortex in your head, which is your parietal lobe and back, the representation of your hands, face, feet is much, much greater than the whole back of your legs. So that is a way that it's less painful. But the way that it's still very painful is that in order for a typical scourging, it goes not only through this top layer, but several layers below, which means you're hitting essentially multiple layers, both superficial and deep receptors all at the same time. So it's a phenomenal sense of burning pain, combined with loss of sensation, combined with dysesthetic pain. So essentially, the initial sharp pain that you feel if somebody touches you, combined with a sharp burning sensation, which is nerve pain. And that will start from the scourging, and it will never stop. In terms of that, how much this actually goes, every single level of the spine, starting at C1 at your head, going all the way down, has very, very well-defined dermatomes. This is C6, this is C7, this is C8. You go here, this is T5, this is T10. 1, 2, 3, 4. Very, very well-defined. So, with going back, with this level from here to here, you're hitting essentially the entire thoracic spine levels are receiving this level of pain. It's not an isolated sense. If any of you have had a foot drop, if any of you have had sciatica, or if any of you have had a disc herniation in your back, you think about how much that hurts, that's from one level. He would have that at every single level throughout his entire thoracic spine. And even some with the lumbar because of how far down this would have extended. So the pain by itself with this is significant. But what is the bigger problem with this? As you get further, deeper into the layers, the bleeding from this is significant. You go through levels of dermis, through muscle, you're ripping all of it open, there's a tremendous amount of blood loss with this. And the problem is not only do you have blood loss with this originally, but because it tears and separates muscle fibers, it also opens it all of it. in such a way that it stays open because it's a tear, it's not a cut by itself. As you lose blood, you actually start to develop hypovolemic shock. This is a really, really big problem. Shock by itself, there's a couple different kinds of shock, which is a little bit beyond the scope of this. This is distributive or cardiogenic shock, where essentially you don't have enough blood. If you imagine your body as a column of water, you don't have enough blood to perfuse the rest of your organs. Your heart, while it's intact, has no liquid to pump. So organs start going down because they don't have the blood supply, they don't have the oxygen supply that they need, and you start to run into problems. Scourging by itself is designed to put you in that state right off the bat. So what happens when you become incredibly hypovolemic? So there's a couple key places, 3 different places in your body that really start to suffer first. One is called the C1 area of your hippocampus. It's the area of your brain responsible for generation of all memory. You start to infarct areas of your brain. 2, you go into instantaneous renal failure because the loop of Henle in your nephron lower down has a very, very minute blood supply which you need for the osmotic gradient to generate urine. And the third one is your bowels. You begin to have bowel ischemia if you don't have constant blood supply. So right off the bat, undergoing the scourging, while incredibly painful because of all this receptor disruption, causes a huge, huge amount of blood loss and puts him in a state of cardiogenic shock, which then puts him in multi-organ failure right off the bat, even before you start talking about crucifixion. So the pain that started then persists, the blood loss that started then persists throughout the end, and this has implications shortly.
Sorry, what's ischemia?
So ischemia is the damage that is done to an organ that is deprived of blood supply. So a stroke is an example of ischemia. A MI, myocardial infarction. Those would be examples of ischemia. Make sense so far? So far, Christ has gone through an incredibly stressful thought process, which has left his skin very friable. Friable means that if you touch it, it bleeds easily. He's already had blood loss from Gethsemane, and he's already been put through this, meaning he's undergone a scourging, he's in incredible amounts of pain from that. He's physiologically depleted, so he's unbelievably dehydrated. He's in cardiogenic shock already. And so he's already in pain and not in a good place, and we haven't left the courtyard yet. Questions so far? So, this is the results. This is essentially what I just went through in terms of where it's at. So then, carrying the cross. So now we only have to go from the judgment courtyard to the place of the skull. Again, very, very consistent recounting of Simon of Cyrene was asked to carry the cross. Why is that? Well, there's everything we just talked about in terms of the physiological depletion. He's already in hypovolemic shock. Well, what does carrying the cross actually entail? Okay, so it was customary tradition that they are supposed to carry their own cross. And we'll get into exactly what the pieces of them were, because I've gotten questions on that. That I will get to when I get to the actual crucifixion portion. But the estimated weight of the cross, any thoughts or guesses what the estimated weight of the entire cross is?
Probably a couple 100 pounds.
It's 300 pounds. For the guys who lift weights in here, how much is that?
It's a lot.
It's a lot.
Is that no part? That's total.
That's total.
Thank you.
So to give people who don't lift weights a good, that upright piano, an estimate of a piano is around 400 pounds. So it's 75% of the weight of an upright piano that an average man would be carrying after he's been through a scourging. But how long did he carry it for? Even if it's a third of the mile, it's 650 meters. So, anybody imagine carrying that upright piano for the better part of 3/4 of a mile?
And didn't he go up a hill?
Well, there's some debate about whether it goes through a valley versus whether it goes up. At the end of the day, he's still too weak to do this, which also tells you where he's at from a physiological sense in terms of how effective the scourging was. You essentially take A normal, healthy Judeo man, you put him through a scourging like that, and he can't do this, and he can't do this very, very quickly in terms of how fast. So this by itself, the bearing of the cross, is a really good indicator of where he's at psychologically and where he's at physiologically prior to undergoing any of this. So he starts out at an enormous deficit,
So he's very dehydrated, right?
tremendously at this point.
And the more you're dehydrated, the performance your body can take drastically declines, right?
It does, which gets into a lot of issues prior to getting into crucifixion. Okay, so you raise a good point. So where is he at from a metabolic standpoint? So he had the Last Supper, which is Thursday night, and this is actually even the next morning. So he's essentially done the equivalent of intermittent fasting at this point. So getting into a little bit of metabolism in terms of what happens with that, there's two kinds of metabolism, aerobic and anaerobic. Anaerobic by itself requires no oxygen, but it's temporary. It uses fat and sugar stores throughout your body. Aerobic by itself relies on the cardiovascular system on your heart in order to provide the long-term nutrition with this. By this point, aerobic metabolism for him, which is your long-term endurance, isn't possible because of his cardiogenic shock. He doesn't have the blood volume in order to supply himself for long periods of time, which means every step he takes, everything he does, is using local stores. That's with his peripheral musculature. Now your brain, the actual neurons in your head, function very, very differently than all of the other musculature throughout your body. The musculature throughout your body, I always tell people that there's 3 different kinds of foods you can have, and there's 3 different kinds of tissues you can have. You can have protein, you can have sugar, and you can have fat. The main different types of tissues is you can have nervous tissue, you can have cardiac tissue, and you can have muscle tissue. Those 3 don't match. So, fat, terrible for your brain, terrible for your muscles, but great for your heart. Gives you a long time, great levels of energy. People say, oh, well, you have high cholesterol, that's not a good thing. The Inuit population whose diet is essentially 100% fat have no cardiovascular disease. Fat's good for the heart. Sugar. Your brain tissue by itself only runs on glucose, the 6-member brain sugar molecule. That's all it runs on. And your liver has to produce it. But it's terrible for your heart and terrible for your muscles. Which brings us to protein. Doesn't do anything for your heart, certainly doesn't do anything for your brain, but it does a lot for your musculature. Christ at this point has not eaten anything, so you take protein out of the equation. You can also take fat out of the equation because he hasn't had that either, which leaves the only supply is sugar, which he's running out of. Which means as he's going through this and he's becoming more and more dehydrated and his physiological reserves are going down, he's becoming more delirious, less focused, which then causes you to start to panic. Have you ever been so hungry to the point that that's all you can think about? Where you almost fixate on it. That is your central nervous system by itself detecting your hypoglycemia, the low blood sugar that you have, and redirecting all of your activities to do that. He's in this state perpetually, and he's not getting out of it.
So, he was fasting, right? So wouldn't he be in like a state of ketosis? So any of the fat storage he had,
Right.
burned that.
So that gets into a state of what exactly is ketosis by itself. So glycolysis by itself is the whole route through which the sugar molecule is actually broken down. And it creates ATP, the energy that the rest of your body uses in the midst of breaking it down. It creates, for every molecule that goes through glycolysis, 32 molecules of ATP are generated. Now you take that for a single molecule of glucose versus 1 trans fat, and there's 112 ATP in 1 fat molecule. That's why fat is a higher energy calorie than sugar is. So then you say he's in a state of ketosis. Once you can no longer do aerobic respiration, so your heart and your lungs don't work anymore, you don't have the oxygen to break down the glucose that your system is using, which is the only thing he's got left. Once that occurs, then you're forced to continue to break that down as much as you can. The state you're referring to in terms of ketosis is something that long-distance runners and bodybuilders experience when their cardiovascular system cannot keep up with the oxygen demands that the system is requiring. That leads to why Christ couldn't carry the cross. He's in a state of ketosis where his energy demands exceed what his body can supply. At the same time, when you have ketosis by itself, you actually develop something called oxygen debt. You know, Kurt understands this being a runner, You ever feel like at the end of it, when you're done running, you have to sit there and you breathe hard for a while before you get your breath back?
If I'm going uphill, yeah.
Right. That's oxygen debt. That's actually what it is that you're breathing there to pay back the oxygen debt so you can recover the amount of energy depletion. At no point can Christ actually do that. So on top of intermittent fasting, being in hypovolemic shock, thinking about nothing but food, he's perpetually out of breath like he just sprinted the entire time, and he can't catch his breath either because he doesn't have the volume of blood to ever get his breath under him. So that's the level of panic, and he hasn't even been crucified yet. Anything else before I get to the next section?
Did the Romans have any expectation that people would actually survive long enough to actually be crucified?
Yeah. So and that gets to the point of, you know, when I get into the breaking of the legs and other things in terms of when they need to speed this up.
Yeah.
The body is a phenomenal. We are fearfully and wonderfully made. Going through medical school and all this, one thing that's incredibly clear, that despite all of this, some people are robust enough and their systems are put together enough to withstand this. And not only withstand this, but actually do remarkably well and withstand this for days. Days.
In most cases, I don't know, Pastor May, you can speak to this, I don't know. In most cases, would it be like prisoners who are then being crucified, so they've already been in prison and
It's
not
possible.
getting, is that probably true?
Yeah.
Yeah, okay.
Yeah. Usually, they're not in the habit of crucifying,
Joe Schmo off the street.
Barabbas.
Were the two prisoners crucified beside him, were they going through a similar initial?
This was a
treatment?
standardized procedure in terms of from the scourging through the crucifixion. So, getting to the actual crucifixion. So, what did that entail? So this is, very good description from Matthew. At the time, he was given a drink mixed with gall afterwards. So what is myrrh or gall, and what does this actually do? So this was by law, was supposed to be given. In layman's terms, this is an anesthetic. So alcohol by itself is a barbiturate. It actually works at the GABA-A receptor. GABA-A receptors open up chloride channels on your neurons and increase the duration over which the inhibitory neurons fire. And so when you have, this is the reason why people enjoy alcohol by itself, is because it's actually an inhibitor, it's a suppressor. But the other thing alcohol does is there's two dopamine systems in your head. One goes through your substantia nigra, which then is involved in movement disorders. Parkinson's disease is an example of that. The other one is through the nucleus accumbens via the ventral tegmental system. That is your rewards learning system. When you consume alcohol by itself, it triggers that reward learning system. If you eat a pleasant food, if you have a pleasant scent or any of that, it triggers the same system. So they give alcohol in order to then both upregulate the inhibitory neurons and cause a dopamine release. What is myrrh? Myrrh is an old-fashioned anti-inflammatory. That's their Advil. That's their Tylenol. How does an anti-inflammatory of this nature actually works? There's actually inhibitors that take the actual long-chain fatty acids in cell fibers and it breaks them out and it turns them into inflammatory cytokines. They're called prostaglandins. When you have a fever by itself, those prostaglandins are going to your hypothalamus in your head and elevating your elevating your temperature. It has a number of other effects in terms of regulating your overall cycle. This just inhibits that. So essentially, an old-fashioned analgesic. Christ refused it. Even in this state, he still refused it. So, getting into exactly how they crucified him. There's a lot of consensus about the positioning of him relative to the prisoners. There's a lot of consensus that he was crucified. But they don't really tell you how or what it involved. So, shape of the cross. Positioning matters. How you do this matters, and I'll get into this in the next couple slides. These are the actual physical pieces to it and the various kinds of positions that you can have. There's also an inverted version of this. I couldn't find a good diagram for all of them in between. This this one right here is the one that is presumed to be the one, just because there is the sign that read King of the Jews. So this is one of the reasons why we presume it's this portion. But it can be any sorts of combination of cross pieces, and you can be inverted as well. Does that actually matter? In terms of the physiology of how crucifixion actually kills somebody, not really, whether you're upright or whether you're inverted. It's the same process, it's just completely 180. But the actual way of how it is. Okay, so Christ is crucified. Obviously, he's being put on the cross. How is that? Hand anatomy is very important with this. There's a lot of huge debate of, okay, is it here versus is it here? Hand and wrist anatomy is very important. So, carpals, metacarpals, phalanges, fingers, radius and ulnar. Very, very large, strong bones, huge tendons that connect all of this. There is really only one way that you can do this effectively. If you put a nail through the center of your palm, right here, you will land it squarely between these two metacarpals. You do that, and you pull hard enough, the nail will pull out of your hand completely. It will just pull out. Now it will create a lot of blood loss because you have a recurrent ulnar artery that runs like this in your hand. So it will create blood loss, but it will not be effective. The nails have to be here. They have to be here. Because it depends on as you're hanging on the cross and being pulled downwards, you rely on the ligamentous structure in order to hold you there. It's the only way that they've been able to hold you that long. But this is a more painful way of doing this. So, and that gets into the nerves. Ulnar nerve, median nerve. So this is one of the portions of audience participation. This is called a phalanx test. Everybody do this. Take your wrists like this, and put it like this, and hang your fingers down. Hold it like this. And if you don't feel anything, raise your elbows a little bit more. Do you feel tingling in your fingers at all? Most people who don't have carpal tunnel syndrome won't. But if that didn't work, feel over this right here and really compress. If you hit the right spot, you will feel shooting pain into these 3 fingers. If you have carpal tunnel syndrome by itself, or if any of you have had it, you will have shooting pain that goes into your hand that radiates up these fingers, and it burns like holding matches to your skin all the time. If you're going to go ahead and nail someone there, you're going to end up putting it straight through his median nerve, which means Christ's hands would have been on fire the entire time that he was being crucified. Both of them, the entire time. So what does this look like in terms of how they would actually do it? So, longer spikes, and the nails are all tapered. So a couple things that would have had to occur is one, they would often use a wooden washer on the top, put it straight through, and then sometimes they would even need to bend the other end to make sure that it doesn't pull back through. But it would cause this, which is called a claw hand deformity. If you put the nail through there and you sever the median nerve, in addition to causing the pain, it de-innervates all of this in your hand. So that's why his hands would have been like this as he's hanging on the cross the entire time. Questions on the hands? Yes?
Would he have maintained that like after the resurrection? Obviously this is speculation, right? But like
It's unlikely.
okay.
It's unlikely. So, there's the hands. What about the feet?
So I do have a question. Can you bleed to death from severing the ulnar and the radial nerve, ulnar and radial artery?
Absolutely you can.
Okay.
You absolutely can.
Bleed out time would be,
So it depends on the extent of the laceration and whether it's complete or incomplete.
okay.
So, and the other thing is that at this point, given that he's in cardiogenic shock, the shock by itself is going to cause peripheral vasospasm. So compensatory from all of the adrenaline that's surging through his system is it's going to clamp down on all the arteries and vessels in his hands. So that's actually it's a life-saving reflex, which is why it causes that. So can you? Yes. Are your odds of hitting the recurrent ulnar artery, the recurrent artery from the ulnar to the radial artery, it's literally a loop there, your odds of hitting there are low. So, and your other arteries, you can actually feel your radial pulse. If you feel right under your thumb, kind of feel in this area right here, you'll feel your pulse right there. So there's one, here's the other one here. And so if you have one artery that goes here, current pulmonary artery, and it hooks into the artery there. So no matter how you're nailing it here, it's unlikely to hit it. But even if you did, with the diameter of this nail, it's unlikely that you're going to have a full transection. And if you did, it's more likely to tamponade. So, the feet. Do the feet matter as much? Well, actually no. In terms of, is there as much debate? So, there's two ways of nailing the feet. Here versus straight through your feet. This way.
Now, they would have put this on a block for him to push up on?
No. And that's part of the point.
Ah.
Is they definitely would not have done that. So there's two ways of doing it. You know, crossing the legs like this, in which case it's straight through the front. If any of you ever whacked your shin right on your tibia on the front, it is the worst thing ever. And the reason for that is anytime you ever break your bone, the pain you feel is actually from the periosteum. It's the layer, small, thin layer of tissue right on the surface of the bone. The bone itself has no nerve endings. The periosteum is incredibly innervated. So whenever you whack your shin, that's why it hurts so badly. So, you do this like this, that feeling of hitting your shin is exactly where they're putting the nail through. And they're putting it through both legs simultaneously. If you can imagine how hard you need to hit that to make it through 2 consecutive bones. With your hands on fire, with your back still on fire from the scourging, in hypovolemic shock, still in your intermittent fasting, in food desperate state, in a sense of delirium because you haven't eaten and because you can't think anymore and your brain's not being perfused.
Okay, so when you're talking about the hands, I was picturing that the nail was going between the ulna and radius
Yeah.
bone. Is that right?
Yeah.
But you're saying with the feet, it's actually going through the bone.
They found
So,
skeletons of crucified people with a nail still in the heel bone.
right. So that's why this actually doesn't matter. That's one way to do it. You go straight through the tibia. 2, this is the fibula here. So tibia is the larger one, fibula is a smaller structural bone. You put it between them right there. Second way. Third way, you tuck the feet up this way and you angle them outward this way and you go through the top this way. At the end of the day, in terms of what kills you with crucifixion, it doesn't actually matter where you put the nails for the feet because it's not as big of a structural in terms of keeping the person on the cross. The majority of the weight is from their hands. The feet is going to be more important with what I'm going to talk about next. So, a couple different ways. The sources even said there's a couple different ways of doing it. The remains that have been found to also kind of support that in terms of saying you can put it through the heel, you can put it through here, the radius, the fibula and tibia, you can put it straight through, you can put it through and tuck them, and externally rotate with that. It doesn't matter. So you'll see variation there. There's no physiological significance as to why you would need to nail it in any specific way. So, what does matter? Breathing. This gets to the crux of exactly how this works and how crucifixion is so horrible. Because everything I've talked about so far is actually not the real reason why crucifixion is horrible. Everything I've talked about so far is just kind of the setup or the prelude to the real suffering of this breath. So, how do you breathe by itself and what's the anatomy? Chest bone by itself, your sternum. Top is the manubrium, bottom is the xiphoid. Connected with floating ribs, lower floating ribs, and true ribs. Floating ribs are connected by cartilage, true ribs are connected in isolation. Go from your spinal column posteriorly through the thoracic spine forward to the sternum. Now, when you inhale and exhale, there is a bucket handle effect, and this is how it's described. As you inhale, your spine is stationary. The front, your sternum, is not. You inhale, and it moves the whole bucket handle forward. As it moves forward, it goes from if this is your spine, if this is your sternum, and you inhale this way, it increases your interthoracic cavity. As you increase that cavity, it creates a vacuum in your pleural space that is less than atmospheric pressure. That's how inhalation works. So how does exhalation work? You do the exact opposite. You collapse your sternum, it brings the bucket handle down, it increases your interthoracic pressure to the point where you then exceed atmospheric pressure and you breathe out. How do you do this volitionally? Muscles of respiration. There's primary and there's secondary. The diaphragm by itself is completely webbed from the back, drapes up over the bottom of the diaphragm, and then connects to the anterior ribs. Muscles only contract towards each other. The diaphragm by itself is a very kind of spiraled muscle, and when it contracts, it's domed up, and it contracts and it comes down. So it increases your volume this way. This is why Stephanie always yells at us in choir, breathe from your stomach, because as you breathe from your stomach out this way, you allow your diaphragm to depress. It increases your true lung volume. Okay, but what are secondary muscles of respiration? All the intercostals, the muscles between every single level, and then your accessory muscles, your trapezius muscles of your shoulders, in order to increase your shoulders up and to pull your whole chest upwards to get that bucket handle to maximally open. So, that's only inhalation, diaphragm, and accessory muscles. What do you actually have to breathe out? And this becomes a real problem for Christ here in a second. You have one set of muscles to breathe out. Your rectus abdominal muscles. Connected to your pelvis, up to your xiphoid. As it contracts, it pulls the sternum back down and compresses it, allowing you to breathe out. Same thing when you're singing, which is why they tell you to train with books on your chest in order to train, because it actually increases your abdominal structure and pressure and allows you to breathe out more. It's also why, the sort of bigger people who are a little bit more overweight tend to be better vocalists. Why? Because they have all the weight sitting there and they create better pressure. That's just how they do it. That's how they have bigger lung capacity. But if you want to increase your lung capacity, have better abs. Just like if you want to increase your cardiovascular fitness or increase your fitness as a whole, abs. You know why? Because it increases your respiratory capacity. If you increase your respiratory capacity, you increase your aerobic capacity, and you can breathe better. And you can tolerate more exercise because your circulation system is more robust. Does that all make sense in terms of the anatomy of how you breathe? Okay.
Can you show can you see in this the exhalation muscles?
So here, and here.
Okay.
So that's the bony and the muscle anatomy. But that doesn't really describe how it works in terms of what is respiratory drive. It's one of those things that's very, very fascinating to study, because it's your central nervous system that actually drives respiration by itself. Your brain as a whole, two different areas, supratentorial, infratentorial, cerebellar hemisphere, and there's an entire system within your head. It's called the cerebrospinal fluid system, or the ventricular system. This area right here in your fourth ventricle is by your brainstem. It's actually the monitoring of that by itself, particularly monitoring the pH that drives your respiratory system. If you were to, for example, stop breathing, all of your oxygen is used up, and your CO2 level goes up high, and your oxygen level goes low. Increased CO2 levels causes this to become more acidic. As this becomes more acidic, it triggers your medulla to breathe faster. You breathe faster, you blow off the CO2, you increase your oxygen, you're fixed. So how does this have anything to do with this, or how does this have anything to do with athletics? Have you ever met anybody from Eastern Africa who can run like no one you've ever met before? And they seem like they never get tired. Because there's actually a mutation, it's called the Eastern Africa mutation. They're missing the receptor for that. Which means when they're sitting there blowing off and their CO2 goes higher and higher and higher, their entire system is super acidic and everything like that, their brains can't tell. Which is why they can just keep going and they don't get out of breath, because their brain can't detect it. This is also why some people can tolerate crucifixion for longer periods of time. They don't feel the stress. Which is kind of wild when you think about it, but that's how these people are running basically 2-hour marathons. They're limited by their musculature, not by their central nervous system. Like imagine running and never feeling out of breath ever. So, that's the pH portion of it. But this is where the receptors actually are. Heart, cardiovascular system. So then as your medulla senses this, and this is, probably should put this one up first, senses the low levels of the low levels of oxygen, the high levels of CO2 is increasing, your pH decreases. Causes your diaphragm to contract. It's going to contract in this very kind of homogeneous rise. It's almost sort of poetic in terms of how uniform and structured inhalation really is. It's incredibly automatic, controlled. And by the time you've reached maximal inhalation, because you'll start to have baroreceptors and positional receptors in your lungs, and then also by the time you start to have return of oxygen within your heart itself, it will tell you to stop inhaling. Then, after that, you'll undergo relaxation of the diaphragm, which usually by itself, just relaxation of the diaphragm by itself, you increase your interthoracic pressure is enough that you will then exhale, and the process repeats. Does not rely, and the reason why I differentiate, if you draw that line right there, infratentorial and supratentorial, the tentorial is the line that divides your brain. Everything above that is what you're consciously thinking about. Everything below that is automatic. Everything below, breathing by itself, which is why you don't die in your sleep. Unless you have something called Onbeaton's curse, which is actually a stroke in this area where you lose the ability to have this occur automatically, in which case you can only breathe when you think about it. There are strokes, there are fates worse than death. So, how is this a problem for Christ, though? So imagine we're in this area where the pH is high in the cerebral spinal fluid system. He needs to take a breath. But imagine you're in a scenario where you can't take a breath. What does that do to your system? The locus coeruleus is right next to the area where this high pH occurs. This is responsible for releasing norepinephrine into the rest of your hemisphere. This is your stress center. If you can't breathe, if you're holding your breath, if you're underwater and you start to really, really feel stressed, like stressed on another level in a different capacity, it's from this. This is what air hunger is. And everything that I've described, this is worse. Complete, pure, unabridged panic. I am actively dying. I cannot get the things that I need to in order to live for the next moment. Locus coeruleus. So this is a problem. This is the worst part of crucifixion. This is what the Romans are trying to get to right here. This is what they're actually trying to do. So how does that occur? Downward force, in combination with the pinning of the hands, causes this. So, another portion of audience participation. Everybody stand up, please. Okay. Find some place where you're not going to run into your partner or step forward or whatever. So imagine, you should go down just a little bit. So, you're standing like this. Raise your hands straight out to the side. Now take a nice deep breath in. Now breathe out. Now drop your hands. You can breathe out more, can't you? Now do the same thing, breathe in as much as you can. Now raise your hands even higher. Now breathe out. Now drop your hands. How much could you breathe out more? It's a lot more, because going back to the whole bucket handle, when your arms are up like this, it engages all of your secondary accessory muscles of respiration and forces maximal inhalation that's permanent. You can't exhale. You have a seat. So, this is what it actually causes. This is the worst part. It pins you in such a position that you are maximally inhaled as much as you possibly can be, and you can't exhale. Leads to the hypercarbia, the high CO2 levels, leads to muscle cramps, delirium, but then triggers your locus coeruleus and you get air hunger because you can't get fresh oxygen. This is how it's done. This is horrible by itself without the scourging. Now imagine you're doing that and your hands are on fire and your whole back is on fire and in pain and you're hypovolemic and you're starved and you're panicked and you're in shock and you can't exhale.
If anyone else did it, it would just be wrong. Very unreverse.
You know, we didn't have anything else going on, so we decided to talk about how horrible crucifixion is. It's bad. This is everything I just described. This is where he's at. He can't exhale. So you're in a horrible state. But then, the question is, how do you get around that? How do you get around, this problem and state that you're in? Well, that gets to what actually killed Christ with this. How did all of this suffering between this air hunger and this panic and this catecholamine surge and the adrenaline and the shock that he's in and the pain from every single extremity and the searing pain on his back and all of this, how did it end? This is very exceptional. This is counter to everything that I've just described. Every single gospel describes how with a loud cry he gave up with his life. You're maximally extended like this, and he's been trying to die for 9 hours. This, in my opinion, is nothing short of a miracle. You can't cry out at all, much less cry out in a loud voice. So then, what actually caused Christ to die at the end of this? What actually caused it? Well, it's very simple. It's gravity. The Romans harnessed one of the most constant forces in the world in order to slowly deprive people of life. Because as you are up like this, the only possible way that you can exhale to get a new breath is by taking your feet and pushing down through your pinned, nailed feet in the cross to elevate yourself just enough to get your ribs to collapse so that you can exhale. Every single breath, you're pulling on the nails in your hands and the nails in your feet in order to get your lungs to collapse enough so that you can breathe. And every breath is like that. And when you don't, then you get the air hunger and the air panic. And it's this trade-off between the scourging pain in your extremities and the air hunger you feel. And it's one or the other forever. And it's that way until you die. So what are the two causes of death in this scenario? Exhaustion and asphyxiation. There are a couple documented thoughts of, yes, you could be in hypovolemic shock. You could come to from the scourging where your volume is so depleted that you actually go into PEA arrest, so it's pulseless electrical activity. If you have so little blood in your whole body, eventually your heart just stops. That's a thought. Or there's a thought of, okay, well, did he have a PE? Did he have something else? Mechanistically, those don't make sense. These are the two that make sense, and number one is the likely the answer in terms of this. So what does breaking of the legs actually do? And we know that none of his bones shall be broken. This hastens death rapidly. People would die within minutes because of this. Because you remove the ability to compensate for the force that gravity is exerting on you. You no longer have the ability to push with your legs in order to get your thorax to collapse in order to be able to exhale. Now, 100% every breath you need, you have to essentially do pull-ups with your arms like this. Tim, how easy are pull-ups with your hands outside your shoulders?
Very difficult.
They're extremely difficult. They're much, much harder here than they are here. Because if you can only engage your back muscles as you do that, which he's already had flayed apart from the scourging. This is why death results in minutes. Because all of a sudden now you cannot compensate. You can't exhale. You can't improve your situation. And oh, by the way, the most painful bones in your body to break are your femurs. And so now you get to add that on top of this, since it's not enough. So, with a loud voice, he gives up his life. Piercing with a spear is something that's very explicit in John. So what exactly does this prove, and what does this show? And so, Pastor, if I could pick on you for just a second, what do they mean by blood and water?
blood and water, we take that to reference the sacraments, the Lord's Supper and Holy Baptism.
Is there anything in the different translations, whether it was blood or water, or the order in which they occurred?
That I have to go back and look at.
So, what does this represent from a physical standpoint? What would actually have occurred? Well, this was actually very customary as a means of determining and confirming whether a prisoner or a victim had actually died. So what was the side typically? Entering from the right, because you can go straight through the liver, through the thoracic cavity, then piercing the heart. It was a very, very confirmatory way. It's incredibly painful, but there's no way that you could withstand this and live. So why is there a mixture of blood and or water? When your heart stops, because this is after Jesus has actually cried out with a loud voice and given up his life. So his heart's no longer beating. When you no longer have a heart beating, the blood backs up in your lungs. This causes a huge amount of pulmonary, something called effusions, where the extra blood starts to pool in the bottom portions of your lungs. Very common in people who have chronic heart failure, which is why people who have heart failure are often on oxygen, because they have so many effusions in their lungs. They don't have enough space to oxygenate. But if you were to pierce straight through this, you're going to get a mixture of this serous pleural effusion, which is going to resemble water, and the backing of blood that goes all the way back through. So, what did he actually go through with this? The Romans came up with this system wherein you can die in the most painful, most arduous, most humiliating and exposed way that simultaneously draws on the physical receptors, everything from your skin, down to the deep core nuclei, wherein you get to experience neuropathic pain throughout your extremities, hypovolemic shock and multi-system organ failure, mixed in with tremendous air hunger and physical exhaustion that will continue until your ultimate demise. In the setting and in a scenario where there is no escape, and there is no hope, and there is no future. If you've ever wondered...
Can I ask you to stop just for a second, T? Boy.
Can I ask a question? on
Sure.
this?
Yeah.
So,
Questions? And references for anybody who wants them.
Do you happen to know, I guess it was Paul that says he twice got the 40 lashes minus 1. Would that have been the same scourging or just a beating? That's why 39. 40 was supposed to guarantee to kill you, so 39. would-
Right.
Yeah, I think part of that's to say that he wasn't killed, but I'll admit I'm beat right now. I'm so tired that
Okay.
I can't give you a coherent answer. Just being honest. Talked so much today.
Other questions, comments?
I think one thing that's interesting with the crosses aspect is that Peter would not be crucified in the same manner. And so that alone leads you to a somewhat limited degree of cross options as well.
It does. So addressing that point, does it matter from the whole asphyxiation thing? Not tremendously, because now your arms are pinned down as opposed to up. You can't inhale. Leads to the exact same process. It's just 180 degrees backwards. So upwards is an exhalation issue, downwards is an inhalation issue.
So, go ahead.
It seems hard to believe, like, when you were describing from the start how long he was bleeding profusely and losing blood, being dehydrated, hungry, complete exhaustion, how you don't simply die of like either a lack of nutrition or blood loss. He's bleeding the whole time throughout this whole process. And the more he moves, the more blood pressure is needed to move anything, say like a 300-pound cross.
Right.
Going 1/3 of a mile, it would seem like the blood pressure would increase, he would lose more and more blood as he goes. I don't know, it just seems like he would.
So
not
it's
be able
impressive
to,
that he made it this long
Yeah.
on the cross.
Do we have an idea of like the timeline in terms of like from the time that he was scourged to his death? Like the time, how amount of time would have elapsed?
10 or 12 hours.
Approximately, 12 hours, which from the time of his arrest through, because they were gathering early in the morning, as the rooster crows, and so on. And so this would have started earlier. I would need to have my Bible in front of me to go through the whole, but we have a very clear, definitive time frame of when all of these events are actually happening. And, I mean, the Passion of the Christ, I think, does a beautiful job of putting the movie that is. Just really putting some of these things in proper place. Chronological order, and then when you're talking about the scourging, for instance, there's a couple scenes in that movie that are horrific to watch, because as you're talking about the flogging and the scourging, you literally see the flesh ripping out.
Would you see that alternation between the rods and then the whips that they use with the thing? So it makes me think with Paul, would he possibly explain how he might have survived? Maybe,
Right.
Could he have been caned both times? In which case, incredibly painful, but not ripping your back skin off.
Right.
As much.
So, by itself, just using the rodding or caning by itself is a far less damaging maneuver, just because it's causing pulverization of that, not necessarily laceration. The worst combination together is actually both of them together, or intermixed, because then as you do that, you soften and you cause all these local hemorrhages and bleeding throughout the entire area, and then you open it all up and let it all drain out. And then you go back to causing more damage, and then you open it all back up.
I'm guessing it wasn't complete, I don't know, if it was completely accurate during the movie Passion of the Christ when they were flogging him, and they decided to use, they were looking which one to use, they used the one that's the most brutal, it's gonna cut you the most, get deep, and they had to stop the soldiers from continually lashing him. So it seemed like they were going overboard more than a normal flogging. So like, is that accurate to scripture?
There's no, the full extent of what is within all of the Gospels as to what the scourging involved is this. That's it. There's no real detail about all of that. So I would.
That movie borrowed heavily from Catholic tradition.
Yeah,
too.
they're gonna take liberties.
But even acting out the scenes, Jim Caviezel actually passed out
Yeah.
from some of the things he had to do, like carrying the cross.
He was wearing like a prosthetic additional layer and pad, but
Yeah.
he did talk about how sometimes the hooks came around and got him in the side of the ribs and stuff like that. Yeah, he was also struck by lightning while on the cross. His shoulder was dislocated when they were putting him on the cross.
So, what was it worse than a normal, say, any other person getting crucified at the time? What was it harsher?
There's no evidence to say anything one way or the other. It's not clear what exactly Jesus' baseline physical level was, in terms of how strong was he actually. Evidence in terms of how he struggled to carry the cross, how quickly he died on the cross suggests that he may not have been in as good of shape compared to the criminals that he was crucified with. Just because of the sheer duration, they survived longer than he did. There's some objective evidence in terms of how long you last as an indicator of how strong you are with this.
And then the biggest question I have, so, say we believe he took on the sins of the world through scripture, and like the deepest wound that hurt him was the one that justice gave. So it's talking about, say, the most painful part kind of was the taking up of all the sins of the world, and that was a part of his stress. I know that's not really something like looking at him scientifically would look at.
So one of the other thoughts in terms of what actually caused him to succumb is spontaneous cardiac failure. Looking at people who fall from tremendous heights or people who undergo incredibly stressful events. One of the things that I see frequently in my practice is I see a lot of cardiomyopathy, so changing of the heart dynamics just because of the stress that the central nervous system is put under. And so one of the other thoughts in terms of what actually killed him is, okay, is it something akin to a broken heart? Is it something akin to the stress and the weight of realizing exactly what he's doing that caused spontaneous cardiac arrest?
Especially since he had all that stress beforehand to cause him, because he knew it was going to happen.
Right.
And so he was literally bleeding blood and that.
Because he was not only aware of what was going to happen in a very perfect sense, but he was also very aware of why he was doing it.
Yeah.
And so that's not an unreasonable, without a full autopsy afterwards or anything like that, that's the level of conjecture. Because the only thing that we know for certain is that, one, he died, and we know why.
What was the name again of the East African, like the runner's mutation, and then what was the thing that's missing?
Yeah, it should be the East African gene mutation.
You looking for a surgery or something?
No, no. I'm just fascinated. Still the concept of, you know,
For you for a race here?
No, I've studied different distance running cultures, and I'm kind of wondering too if like the Taro Mara Indians who could run hundreds of miles at a time, if they might have had a similar mutation or something.
Well, and it's small evolution. The people who could run were the ones who got to eat.
Yeah. What was the name of the thing that was missing?
It's a pH receptor in their medulla.
And there is one, the one non-medical aspect to this is that Christ is in control. While he humbles himself, and we see his humiliation really displayed throughout his life within this world. And it seems so foreign to us, but his exaltation, his crowning is actually being on the cross. And so when he says, Father, into your hands I commit my spirit, he is giving it up. It's his control. It's in his being to do so as God, and he is the one who declares it is finished. So that would be just the one aspect that, from a theological perspective, as we're looking at all of this 360 degrees and appreciating the medical aspects and the human elements that go into this, the spiritual aspect still remains what we confess in the Apostles' Creed. The Father has created, the Son has redeemed, and the Holy Spirit continues to sanctify and keep us holy. But that's only done because Christ comes and takes on our human flesh, and he gives himself for us.
Speaking of humiliation, like on the cross, you see a lot of depictions of he's got a covering over himself. That wasn't actually the case, right? He was probably naked.
There's no consistent report. Is the short answer. There's varying amounts of it. Victims were stripped. The casting of lots and the dividing of garments, sort of the hangman's boots, that is well documented in terms of that occurring. So whatever would have been left would have been very minuscule.
You said too, the scourging went all the way down to the glutes as well.
Yeah.
So,
Most likely.
So simply walking would, even if the rest of his back was fine, having your glutes literally shredded, not figuratively shredded, like would just be ridiculous. Yeah.
Any other questions?
Is there some significance to the direction of the whip marks on that one
Yeah.
slide? Because it seems to me that, and I think in the reading there's like unfurling and strips of skin would come off, what have you, and then you talked about, well anyway, let me let you comment on that first.
So muscle fibers run in this direction. And so if you're going to go in line with the muscle fibers, you can do more damage that way. And so doing it, but the other thing is, and Robert, getting to your point in terms of how badly they were scourging him. If you do it this way, you're going to cause a lot of physical damage and a lot of pain. but you're going to leave enough of it structurally intact. If you go this way, through your lats and through the other musculature, you'll actually sever the muscle fibers instead of shredding them, which will then enable them not functional. And so it's a way that you can damage them while preserving some level of functionality.
So would you say there's some sophistication in what they're doing?
They've thought about
They
this.
thought about it.
Yeah.
That means that we're not always smarter than previous generations.
Yeah.
I think the Romans got it from the Carthaginians too.
Well, but the point remains, like,
It's like everything.
And then refined
they
it.
often find that we were smarter than the past, and the reality is that the past continues to inform us.
Yeah.
Without any dislocation, or would that have been a possibility?
Certainly, by the time you
Maybe
get,
not with Christ.
when you get to the cross itself,
Yeah.
if you know, as you're hanging up like this, dislocating your shoulder is not as difficult as people think it is. You know, you can, with the right application of 2.5 pounds is all it takes to break your wrist in the right directionality. So, in terms of hanging like this, depending on what your pectoral and your rotator cuff structure is, merely hanging like that for a series of hours in all likelihood wouldn't dislocate it.
Was it cold?
I have no idea. I have no idea.
Oh, that would be bad if it was cold.
Weather reports were not,
Yeah.
not the Gettysburg
Yeah.
I mean, if we saw, no,
Yeah, the Chinese weather blew it out. So we wouldn't be able to sense the cold. Too soon. I've got to wonder, would he even be able to sense the temperature at that
Yeah,
point?
I
Everything's so
don't
frayed.
know.
Would he just have the sensation of burning,
Yeah.
regardless of what temperature it was?
Well, I mean, it would have been, it was cold enough that there was a fire. We know that.
well, that's right.
We know that it was cold enough that they required a fire, but, I mean, the sun's rising. Any of us who have been over in that part of the world knows that it can be different.
We celebrate Good Friday towards the end of winter, right? So, is that-
Well, I mean, Good Friday, it comes from, there's a couple different manners of calculating time for Good Friday, and the one being, that Easter is the first Sunday after the first full moon, after the spring equinox, so on and so on. But then you also have, it coincides with Passover, obviously, but you also have the belief and understanding that so the one theory is that a prophet lives a perfect life, meaning the day of their conception is the day of their death. And thus, if Good Friday was approximately around March 25th, the Annunciation of our Lord, okay, that would be Good Friday, approximately. Thus, that's how you get December 25th, Christmas Day. And so the theories of the church and the beliefs of the church from historic practices feed into also. So we have the general idea from when the Passover was within a good time frame.
Well, actually, we know precisely.
Okay,
Yes.
so
April 3rd.
Well, so we have a very good time frame.
Yeah.
Churches do debate that question regarding East and West, whether you're Orthodox or you're Roman Catholic and so on. So there is a good time frame in which we could work, and thus you also have a difference between March 25th and April 6th, and or December 25th for the Christmas that we celebrate, or the Eastern Orthodox doing January 6th. And if you fast forward to Christmas here, the compromise between the two is the 12 days of Christmas. That's how you get the 12 days of Christmas. Is really a compromise between the two, and so on. And so they're intimately related, Christmas and Easter, in such a way. So.
So help me to understand when you said that they pierced him with a sword and they went through the liver and then to the heart. And we have
With this.
literally no pain receptor sites because there's hardly any skin left. So Q's gone. Why would, when you said it was painful, is that because of what you explained was happening in the lungs? Because internally,
in
the
terms
organs
of-
don't have any pain receptor sites to
Right.
speak of.
If you were still alive during this,
Oh, okay, I see where you're coming
if
from.
you were still alive, yeah.
then
I mean-
going through the, okay.
Correct.
So when you say to confirm death,
Mm-hmm.
it just basically meant that if they were still living, this would finish them off.
This, based on the sources that I found, was only ever done as a confirmation after they believed the victim was already deceased.
So and how does that confirm death? I mean, what were they looking for to confirm that the guy was?
Well, this sort of a thing, in terms of entrance here, going through your manubrium, through your hepatic, into your heart by itself, one, it's a catastrophic level injury. Two, they definitely would have responded in some capacity, and Christ didn't respond. Like this is a level of stimuli that even in the midst of all of this other stress, he still would have responded in some capacity to this.
So the blood in the water is a standard
So the blood in the water
pouring. That's normal to pour out whether somebody was like just about to die or if they'd already died or if it's
Correct.
anybody but Jesus.
Correct. The bigger issue in terms of how this is a confirmatory is not the blood in the water, it's the lack of the response with them doing it.
And you said it went through the ribs, like in between the ribs.
Yes.
They wouldn't
Yeah.
have let it go.
And it would have to.
Yeah.
In order to produce in order to produce that. Of course, if they're just nicking it like this, it actually wouldn't have produced any blood or water. You'd actually have to enter the pleural space to get into lung tissue, lung parenchyma, in order for it to produce what it's documented that it produced.
And they would have gone
The
into
narrow
the
pilo
heart.
would fit pretty well through that. The tips that they had on the pilo would actually be able to do that.
So, help me to
Oh
understand.
yeah, I mean, a Roman spear
Yeah.
points that.
I guess, okay, so I always thought that it was the sword piercing the pericardial, the space,
Mhm.
the heart and the pericardial, I know you know what I'm talking about. But there was fluid in there, and I thought that's what was rushing out, not the case.
So
The
the
way you were
amount
explaining
the
it.
amount of fluid that you have within your pericardial space, getting more medically with it. If you have a pericardial tamponade by itself, that's hematological in nature, it's not serous. And so it would not have been a mixture of blood and water, and the volume is an issue, and how far you have to traverse from the level of injury of the pericardium, retrograde back through, crossing midline, back through and expand to the lung. in
That
order to
makes
get that.
sense, yeah.
So, is it impossible? No, but the pericardial tamponades that I've drained don't fit this description. Pleural effusions from lung backing up from spontaneous cardiac arrest fits much better with that.
Yeah, okay, thank you.
Does anybody have one last question?
Not, we'll be at church on Sunday. Right?